Everyone, my name is Jeffrey Colucci, and I serve the university as Student Body President. And I'm here today with Dean Rivera, the Dean of Students, and Dr. Davis, Vice President for Student Life, to answer some commonly asked questions from our campus community surrounding COVID-19 testing. So to start us off, what kind of testing is currently happening on campus?
Sure, Jeff, good question. First, thanks for giving us this opportunity to answer these questions. I think it's important that we share this information in this forum. So right now we have two types of testing that are happening on the university's campus. One and so far smaller version of testing has been symptomatic students who have either self-identified to Student Health Services or who have answered the wellness app on a daily basis that said they have symptoms. They are going to Student Health Services and they're being swabbed as possible COVID-19 cases. So those are symptomatic students through Student Health Services. In addition, we're doing a screening testing program that's being run in the Long Center every week for both students and employees of the university. And each week we're testing about 1,000 people. We have capacity to test about 1,200 per week, but the last 2 weeks it's been about 1,000. And what we're doing there is trying to find asymptomatic people who have the virus. And that way we're able to identify them even though they don't have symptoms and isolate them from the community to try and prevent the spread. So we're testing both asymptomatic people through the screening program and symptomatic students through Student Health Services.
So can you explain a little bit in more detail the campus metrics, summary statistics that we see in the weekly health and safety updates?
Sure, and I think maybe the first thing to say about the campus metrics is they are a snapshot in time. So they are a weekly report that covers Monday morning through the following Sunday evening. So the numbers are stagnant and they certainly move throughout the week. So sometimes they change pretty rapidly. But in essence, what we're doing is trying to capture for everyone at that moment, Sunday night, how many people tested positive in the last week, how many people are currently in isolation and quarantine, and how many people in that same time frame were let out of isolation and quarantine or met the standard to get out of isolation and quarantine. We've received positives. Let's use that. That's probably the easiest one to describe. Positive test results come in three ways. The first two through those testing programs that I just described, either symptomatic students in Student Health Services or screening tests in the Long Center. The third way we find out about positive tests is from students self-reporting positive tests from outside providers, either their own healthcare provider or an urgent care clinic or hospital who's done a test for them. Students are reporting that because it's part of the Royal Safe Together plan that you self-report a positive test, but also when you report a positive test, we're able to provide you with the academic and social support you need to once we find out that you've had a positive test. So those are the three ways we get the positive tests. I'll just remind students that it is a requirement in Royal Safe Together for them to report a positive test so that we can keep accurate numbers. But I'm pretty confident through the first couple of weeks that those three ways of us receiving tests have led to an accurate representation of where the virus is on our campus. Isolation and quarantine, students who test positive are then put into isolation for 10 days. Then students who they identify as close contacts are contacted by university contact tracers and determine whether or not those students need to quarantine. The quarantine protocol lasts 14 days instead of the 10 days for isolation. And we use those two items, isolation and quarantine, to keep people sort of restricted in movement to ensure that we can moderate the spread of or mitigate the spread of the virus throughout campus. So then the third metric I think is important to note is that each week those 10 days and 14 days of isolation and quarantine are up for certain students. So they will be let out and allowed to return to normal life on campus. So that's kind of an overview of the three types of numbers that we're reporting every week. But I think most importantly, I'll reiterate, it's a snapshot in time. So it's accurate as of the moment we report it, but it changes as the next week starts.
So how long does it take for results to come back from the screening tests? And are students and employees contacted if they test negative through those screening tests?
Yeah, that's a good question, one we've been getting a lot. So typically through the first 2 weeks of screening testing, what we found is that most results are available within 48 hours of the person being tested. So we send the swabs every night after the testing is over to the lab, which is in central Pennsylvania. And it seems that when they receive it that night, it takes about 48 hours for them to turn it around, but between processing and getting us the results. I think it's safe to say if you haven't heard from us in about 72 hours, in most cases that means you tested negative. Of course, I'd say that's in a general sense. If you've tested negative, we are not calling students and we're not providing a proof of a negative test. So in a screening program like this, the only folks that are notified are the ones that are positive.
So what if a student in a class tests positive? Would that mean that the entire class would have to quarantine?
That's a good question, Jeff. No, fortunately, that's not what it means. As you've probably seen as you've navigated campus, nearly every space on campus has been taken for use for academic purposes or for dining. And the reason for that is because we need to distance everyone, right? We know that in order to mitigate the spread of the virus, masking is very important, as is remaining 6 feet away or more from other people. So our classrooms are set up such that faculty members and students and other students are all more than 6 feet apart on each side, given that we haven't had any close contacts in the classroom that have been reported thus far. So that's something that seems to be working out well with our plan. The close contacts tend to be people identified from outside of that academic setting.
So one final question. Is there a certain number of positive cases on campus that might force the university to close?
Yeah, Jeff, that's a good question. I think, as we've seen more media attention around institutions making decisions, that it becomes something that we hear a lot about. And I'd say at this moment, as we've gone through the planning, there is not a set number of active cases or cumulative cases that we've set as a barometer for whether or not the university would close or, change instruction models or think about what was happening on campus. Really what we're doing is trying to monitor it on a daily basis and recognize whether or not we can manage with the number of cases we currently have. So last week we reported an increased number of cases. We were able to manage the effects of that from both an isolation perspective and a quarantine perspective. As the cases have continued or continue to be identified, we'll continue to manage whether or not we can keep the operations going in the same way or whether or not we need to rethink what we're doing. But there is not a set number at this point, certainly not from Pennsylvania or the CDC, which is the two groups we've been following in terms of our guidelines. So with that, we're monitoring the circumstances in Lackawanna County, which is the university's home county, but also more closely the activity of positive cases on campus.
Good to hear. Well, thank you, Dean Rivera and Dr. Davis, for providing some insight and answering some commonly asked questions by members of our university community surrounding COVID-19.
Thanks, Jeff.
Thank you, Jeff.